Evening, everyone. Welcome to another session of Healthy Hints from the Health Advocacy Ministry, also known as HAM. We all know that February was American Heart Month. Dr. Wise preached about the troubled heart all month. But tonight we're going to discuss heart disease. I know it's March, but we know that heart disease is the #1 killer of Americans, so maybe we should talk about it more often anyway. Our guest tonight is Dr. Charles Noble. Um, a prominent physician in our community, Dr. Noble, participated in a video earlier this year encouraging the COVID-19 vaccine. So we're going to start the night off by watching the video. So let's take a look.
It all began in the year of 2020,
when a virus, better known as COVID-19,
changed our lives and devastated our communities.
COVID-19 has impacted our jobs,
our children's ability to go to school,
our ability to socialize and gather with our loved ones,
and prevented us from worshiping at our faith institutions.
And we already knew that healthcare disparities existed.
This pandemic has highlighted just how much of a disparity exists as it relates to people of color.
Did you know that thousands of people die every day of COVID-19?
As people of color, we are more likely to get COVID-19.
More likely to be hospitalized.
And we are most likely to die.
As people of color, we are more likely to work in essential jobs.
And many of us live in multi-generational households, which increases our risk of the virus.
We are dying and burying our loved ones at a much higher rate as compared to other racial and ethnic groups.
We have to make a change. Although we face such adversity, we are a powerful and resilient community.
The COVID vaccine is now available and is an effective weapon to fight this virus.
This vaccine provides so much hope for the future.
Did you know that a Black scientist was crucial to the development of the vaccine?
As a matter of fact, there were several Black scientists who were on the FDA advisory committee who heavily scrutinized the vaccination before it was widely distributed.
Did you know that thousands of people of color were included in the clinical trials to test the safety and the efficacy of the vaccine?
People that look just like you and me.
Now, I understand that you may be hesitant to get this vaccine, because I was too, until I did more research.
It's so important that you review credible resources when making a decision about this vaccine.
We understand the healthcare system hasn't always been kind to us.
We remember the Tuskegee experiment.
And we remember Henrietta Lacks.
We know the history of our healthcare system.
But we have made so many advances since then.
And people of color are in key decision-making roles.
As Black physicians, we are our ancestors' wildest dreams.
We went into medicine to advocate for you,
to educate,
to counsel,
to heal.
Please, follow our lead.
When you make the choice to get vaccinated, you are not only protecting yourself from a serious illness,
you are protecting your family,
your friends, your entire community.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated.
And that's why I got vaccinated. And we hope that you will too.
So this evening we have Dr. Charles Noble, who is not only going to talk to us about heart disease, but he's also encouraging us to get the COVID vaccine, the COVID-19 vaccine. We're going to start a little different tonight than we did last month. First of all, good evening, Dr. Noble.
And nice
welcome
to be with
our
everybody.
session.
Thank you.
Welcome to our session. We also have Tamika, who's going to also be reading the questions off to us tonight. But what we're going to do to get Dr. Noble talking is we're going to just go right into asking him some of the questions that we have. So if we want to start with Tamika, if you want to get started, and then we'll take questions as we get them online.
I can't. I think you said it's my turn.
It's your turn.
I did. It's your turn.
Okay. Hi, everyone. I'm sorry I'm having technical difficulties, but let's work. Okay, Dr. First question: how closely related, or are they related?
Okay, Tamika.
Ella, let her.
Can you hear me?
Ella, go ahead and read
the
question yourselves.
I also have a list of those questions if you get to a point where you can't do it.
I am going to have to do something.
Go ahead, Ella.
Okay, Dr. Noble, the first question we want to ask you is, how closely related is heart attack to stroke, or are they even related?
Thank you for the question. Just to give people a little bit of a background, I was in practice for 25 years, and I was a practicing electrophysiologist, cardiologist, someone who specializes in rhythm disturbances. And we had a pretty large practice, and we took care of a lot of patients. And heart attacks and strokes are something that we saw a lot of. So to begin with, cardiovascular disease it encompasses a wide area of disorders that affect the cardiovascular system, which includes not only your heart, but also your arterial system. So as you know, as the heart pumps, it pumps blood under pressure to the arteries, and the arteries are like the avenues to your dependent areas like your hands and feet and legs and your brain. So anything that affects any part of the cardiovascular system, including the heart and arterial system, are all connected to what we call a disorder, and that's what determines that cardiovascular disease is. So unfortunately, especially in this nation, we tend to see evidence of plaque disease very early, even around the adolescence. And plaque disease represents a hardening of the blood vessels. So the same process that occurs in the heart in terms of the arteries that supply the heart muscle, that same process also affects the arteries that go to your brain. So in one circumstance, those plaques may cause heart attacks. In another circumstance, the plaques may cause a stroke. It just depends on where the plaque is located. The treatment and the risk factors for both of them are essentially the same. So there is a syndrome called metabolic syndrome. Other names for it are called syndrome X. It's a list of 5 categories that tend to put people at high risk for developing cardiovascular disease. That includes obesity, hypertension, diabetes, high cholesterol, and a lowering of your good cholesterol. All of those things can result in the plaques building up on the inside of the vessels. And when those plaques become obstructive, meaning that there's no further blood flow through there, then that's what causes the symptoms of both stroke and heart attack. So to simply, I don't want to get too into weeds unless you want me to, but all of those things are connected because they're all part of the cardiovascular system. And so we can talk this evening about how to mitigate some of those risk factors, but generally that's what we're looking at. We're looking at the mitigation of the risk factors that leads to the hardening of those arteries.
Thank you. The next question, can you guys hear me now?
We can hear you well.
Yes.
Awesome, thank you. I'm so sorry about that earlier. Next question. My sister's heart stopped at the dialysis center and they could not revive her. My son's mother-in-law also is a dialysis patient who suffered from a heart attack and passed away. What is going on with the heart during dialysis?
Well, first off, when you look at most of the people that are on dialysis, they have kidney disorders. And probably the leading cause, especially in the African American community, for kidney failure is uncontrolled hypertension, high blood pressure. The new guidelines for blood pressure management are to get your blood pressure 120/80. And that's regardless of your age. Those are the current recommendations. They've actually changed that recently. So uncontrolled high blood pressure leads to pressure in the kidneys, and it causes the kidneys to really overwork to a certain degree. And the kidneys start scarring, and that leads to renal failure. So when someone is on dialysis, well, let's just back up a second. There are a couple of forms of dialysis. There's something called peritoneal dialysis, where you actually get dialyzed through fluid in your stomach. Most people recognize the dialysis that involves something called an AV fistula. And that's an artificial fistula that you put in your arm that they hook up to the dialysis machine. So once you are on the dialysis is actually filtering your blood of the impurities that your kidneys can't manage. And so when you're on dialysis, the blood flow is being directed into the dialysis machine, and sometimes your pressure can drop. Sometimes you can get things like infections. Sometimes the electrolytes get off kilter. So for instance, the person who heart stopped when they were on dialysis, it's possible that their potassium could have been too high. Or people that have kidney disease also tend to have electrical disorders of the heart. And when the heart stops, then there's no blood flow. And when there's no blood flow, you've got, really minutes to revive those patients. Otherwise, it's fatal. So just summary, being diverted from the AV fistula, from the person, into a dialysis machine, which is cleaning up the impurities. And during that, you can get what they call hemodynamic changes, meaning the blood pressure can drop. You can have electrolyte abnormalities like high potassium. So they have to manage all that while they're in the dialysis units. And those guys are really pretty good. But unfortunately, the same thing I talked about before, you asked me about what's the connection between heart disease and stroke. Well, the same thing applies for people that have kidney problems. It's really essentially all the same, because hypertension also leads to heart attacks. It also leads to stroke. And we know that in the African American community, about 45% of all adult men have hypertension. About 45% of adult women have hypertension. Of those, about half of them are controlled. And when we say controlled, again, the guidelines for controlling blood pressure has gotten really stringent, because what we've found, that if I can control your blood pressure, then your risk for having a cardiovascular event, such as a heart attack or a stroke, is markedly diminished. So all of those things are tied in. They're separate in the sense that you treat them differently, but it's all cause and effect. And one of the main things that drives our cardiovascular disease in our community is high blood pressure and uncontrolled high blood pressure.
Wow. Good information. Thank you. Dr. Noble, what is congestive heart failure?
Okay, so congestive heart failure is really divided into two categories. Either you have your heart muscle is pumping correctly and you still have an overload of fluid in the body, and that can be from a number of reasons, but congestive heart failure is a syndrome. And the syndrome is usually fatigue, shortness of breath, and swelling. So when your body has accumulated more fluid than it can get rid of, then it backs up either into the tissues, like in your legs, or into the lungs. And if it's into the lungs, then you have trouble breathing. So congestive heart failure is a syndrome. It's a compilation of multiple symptoms. And generally it's because of a fluid overload. Now that fluid overload can either be because your heart is too stiff, and it's called diastolic dysfunction, and a lot of African Americans have really increased stiffness in their heart because of the blood pressure. Again, we're tying it back into blood pressure.
Mm-hmm.
So high blood pressure can also cause congestive heart failure. And if that pressure goes for a long time untreated, then the heart muscle starts to get damaged, and that causes an enlarged heart. So there are two types of heart failure. One where their heart muscle is just real stiff, and the other one where the heart muscle is just not working very well. Both of those can lead to the syndrome of congestive heart failure. And that, again, is those symptoms I described.
Okay. Thank you. So it sounds like we really need to be controlling our blood pressure too in all of this, huh?
If there's a message in this, it's really blood pressure control is extremely important. And, you know, hypertension, or that's what high blood pressure is usually something called essential hypertension. That's an inherited form of it. Most African Americans have a predilection for high blood pressure. That just runs higher in our community. When I was in practice, some of the most severe elevated blood pressures were in African Americans. And sometimes it would take me 4 or 5 medicines just to get it down to where they wouldn't go into heart failure, or they wouldn't have a stroke, or they wouldn't have a heart attack. So it can be very difficult to treat, but that's why it's important to follow up with your family doctors to make sure someone is checking your blood pressure. Now, the things that contribute to that is poor exercise and obesity. So if you're not getting much exercise, your pressure goes up. If you're overweight, your pressure goes up. Too much alcohol can cause your pressure to go up. Too much stress from COVID and from this whole stress can pressure to go. So there's a lot of factors that affect high blood pressure, but it's really important to get it under control, because if it goes unmanaged, it could lead to some serious illnesses.
Wow, thank you. So the next question kind of ties into all of that. So according to the CDC, stress, anxiety, and depression can lead to heart attack. Have you seen an increase in heart attacks since this pandemic?
Well, it's kind of, the COVID has kind of changed that to a certain degree. Not only the stress and the depression, but people that get infected with COVID also have cardiovascular issues, because the COVID, the research has found that these patients are what they call hypercoagulable. I know that's a long medical term. I'll try not to use too many of them. But it causes a clotting in the blood vessels. And we know that some people have actually had clotting that has caused strokes and heart attacks in the COVID patients. So this virus is very serious and very dangerous, and it can lead to some of those things. And I was just looking at some research data the other day, and what we found is in the COVID patients, the people that get the sickest, those are the patients that go into the hospital, that end up on the ventilator, that need to get all these therapies. It really basically a couple of categories. The people that have high blood pressure, the people that have diabetes, and the people that have obesity. That just sounds like what I'm describing our community needs to get a hold of. And so what has happened is those patients who get COVID, they get the sickest because it really attacks the cardiovascular system as well. So, so to answer your question, yeah, we've seen more cardiac issues associated with this virus, on top of the fact that there's more stress and more depression associated with it.
Wow, thank you. Okay. Statistics show that women die from heart attacks more often than men because their symptoms are different. As a woman, how can I tell if I just had heartburn or am having a heart attack?
Well, cardiovascular disease kills more people than all cancer combined. I don't know if you guys know that. So, not only just in women, but just in the United States in general. The presentation for heart disease can vary, and it's not always classic. The classic symptoms of having a heart attack is really a pressure sensation in the middle of your chest. That's the classic. Sometimes that pressure then radiates down into the arm and into the jaw. That's called referred chest pain. And some people don't develop those kind of symptoms, and it feels like heartburn. I'll give you kind of example of that. There was a neurologist when I was in practice, like in the early 90s, who unfortunately died from a massive heart attack. And when they did the autopsy, they found Tums and Pepto-Bismol. And even as a doctor, he didn't recognize the symptoms of a heart attack, and he thought he was having heartburn. So generally, like for instance, if you never are predisposed to heartburn and all of a sudden you have it, don't just assume it's heartburn. It could be heart disease. Probably the most common presentation for heart disease, especially in women, is fatigue. They may complain of fatigue before they complain of anything. They may just be excessively tired and they can't explain it. And that's something that we see a lot in terms of presentation. Sometimes the only presentation is that you break out in a sweat. And so there are a lot of different types of presentation. It's not all just chest pain. And generally, the chest pain is not sharp. It's usually a heaviness and a dullness. But women do tend to have atypical symptoms. And I will tell you, probably the biggest one is fatigue, like I said, just extremely tired. So if you're feeling really tired, just don't think that, you're run down and you really need to get it checked out, especially if you have a family history of heart disease. So if you have a family history of heart disease and you have risk factors like hypertension, diabetes, we don't talk too much about tobacco, but that's still a major cause of heart problems. So if you've got any of those kind of symptoms, it's important to get it checked out by your family doctor. Just don't assume it's heartburn.
Okay, Tamika,
Now,
we're going to take some online questions.
Okay. Can I ask just one really quick
Right.
question, though, as it relates to the symptoms? Many people,
Please.
you always hear people say one of the classic signs is just the left shoulder pain. Is that something, or can it be the right shoulder? I mean, right shoulder.
It can be.
Just curious.
That's why just purely from a science standpoint, there are nerve fibers that surround the outside of the heart called the pericardium. And those nerve fibers have different routes. And so when you experience pain in your chest, it's referred down the nerves. And if those nerve pathways are either to your right shoulder, left shoulder, jaw, arm. In fact, I've had some patients only had elbow pain. They just had this severe elbow pain. So it just really depends on where those sensory nerve fibers are located. So you can't just, I've heard some people say, well, doc, I had this pain in my right shoulder. I knew it couldn't be my heart. No, that's not the case. You can have it literally anywhere. So don't just assume because it's not in a classic place that it could not be your heart.
Okay. Thank you.
You're welcome.
Okay. One of the questions that one of our viewers has is, what are some of the simplistic and most common missed early symptoms or signs of a stroke?
Well, just like in the heart, the symptoms are related to what area of the brain that the stroke is occurring in. Okay, so and whether it's from plaque that breaks off, like this is your carotid artery in your neck. Most people, not I should say most, some people have plaque that develops there that goes up to the brain, and it depends on where the circulation in the brain causes certain symptoms. Like for instance, if it affects the area of speech in your brain, then you're going to fumble your words and things like that. If it affects the cognitive portion of your brain, then you're going to forget, and your memory may not be as good. If it affects the motor part of your brain, then you may have your arm may be weak or your leg may be weak. So it really just depends on what area of the brain is affected. So weakness, speech abnormalities, memory, those are the kind of things that generally people experience when they have a stroke. Now, sometimes you might have an early warning of it. And if that happens and it improves, and some people just, well, it improved and they don't think much about it. But if you have any of those kind of symptoms, you really ought to check with your doctor, because if it's not completed, then it's not permanent. And you want to try to get to that as early as possible. And so we've got some really, the advances in stroke management have been just amazing. And now when people, they've got protocols, both in the emergency, like in the emergency squad as well in the hospital. If someone is within like 5 hours of having their symptoms, you get to the hospital and they can actually prevent you from having permanent damage from it. But the important thing is to get the early symptoms you need to call and have someone see you or go to the hospital or call 911, because the earlier they can get to it, then the less chances you have of it being permanent. Because I'm sure you've seen people have trouble walking, they can't use their hands, their speech. You want to try to prevent permanent damage to the brain from occurring. So any of these early symptoms, you really need to call 911 and get evaluated, because they can prevent that from happening.
Thank you. Okay.
You're welcome.
Dr. Noble, what are some of the differences between symptoms of a heart attack, excuse me, in women and men?
Well, the symptoms of a are generally, with both men and women, it really depends on how much damage is done to the heart and how much actually disease in the heart. Because you've got, like, in the heart, there's just not one vessel. There's something called the left main that comes off the aorta, and I know you guys let me go and all that stuff, but anyway, that divides into several branches, and depending on what side of the heart and how much the heart is affected will really determine the symptoms in both men and women. So if you have a lot of damage to the heart muscle, see, the vessels supply blood supply to the heart muscle. If that muscle doesn't get any blood supply and that area dies, then your symptoms become much more dramatic if a larger portion of your heart's affected. That can lead to those congestive heart failure symptoms that we talked about previously. Because the most common cause for a poorly functioning heart is heart disease, coronary disease, heart attacks. So the more of your heart that's damaged from blocked vessels, the worse your symptoms are going to be. To the point where, you can get really short of breath just doing little things like combing your hair or taking a shower or playing with your grandson or granddaughter. And so it really just depends on just how much heart disease is there, really determines what the symptoms are. But in terms of there being a difference between men and women, they're generally, the same things that affect our heart really affect women's hearts as well. And it just depends on how much of a burden there is in terms of the coronary disease and the muscle that is affected by it.
Oh, oh, thank you.
Mm-hmm.
Do you recommend taking a statin if you have a high calcium score test,
Okay,
although your LDL and HDL are within normal limits?
that's a very good question. So just to give people context, a calcium score is a calcium scan that we do. It's an imaging modality, and it's not really X-ray. It's more of a CT scan that we can do of your heart, and we are able to use these algorithms that determine the burden of calcium in your blood vessels. When that number is more than 200, your calcium score, then your risk for having heart disease increases. And the calcium is in the plaque. Plaque is the blockages in the blood vessels. So when you have a lot of plaque, especially plaque that's been there a long time, then you're going to have high calcium scores. So the high calcium scores really mean that you have a lot of heart disease. So the things that lead to plaque formation is generally how we manage our cholesterol. And the components of cholesterol are broken down into subcomponents. LDL cholesterol is one component, and HDL cholesterol is the other component. L, for simplistic purposes, is the bad cholesterol. HDL is the good cholesterol.
Mm-hmm.
So the HDL actually goes into the plaques and it removes cholesterol. That's why it's important to have a high HDL level if you can. If you got high LDL levels, then it's really important. The studies show that you have to be on statins to get that LDL. Now the recommendation, the normal LDL with no history of heart disease is less than 130. But if you have heart disease, they want that LDL down to less than 100. Now, is it possible that the LDL and the HDL don't necessarily tell the whole story with cholesterol? And it's true, because there are other smaller particles of cholesterol called LP little a. Those are really getting a little more technical. So if you have LDL, your HDL is normal, you need to see an endocrinologist or a cardiologist that specializes in managing lipids. Another term for lipids is cholesterol, because there are other smaller particles other than just LDL that can lead to heart disease. And I've done some of those studies, and when you look at it, you're really surprised because they're smaller particles. If you don't look for them, those contribute significantly to the development of heart disease. So if you've got a high calcium score, then you really need to see a specialist so they can manage, because not all the medicines work in the same manner, and you may need a special medicine that gets at those smaller particles of those cholesterol particles to prevent you from developing more heart disease. And then secondly, if you have high calcium scores, you really need to do your own management. Exercise, weight loss, getting plenty of sleep, all those things are still important, because if you recall when I first started out the discussion this evening, heart disease is an inflammatory disorder of the blood vessels. It's inflammation of the blood vessels. It's the inflammation that leads to the blockages. And so, and our diet contributes highly to that inflammatory disorder. So if you're eating a lot of fast foods and all these kind of things, processed foods, simple sugars, all that increases the inflammation in your blood vessel and causes blockages. And that generally is reflected in what your cholesterol and your blood sugar and all those kind of things are. So that was kind of a roundabout way, but that was a very good question. My advice to whoever sent that is definitely see an endocrinologist or a cardiologist that specializes in lipid management, so they can really do some of these other more refined tests to determine how you need to be treated appropriately.
Wow. Good. Okay. Hi, Dr. Noble. Can you explain what broken heart syndrome means?
Yeah, broken heart syndrome is a disorder described by the Japanese. And what it is years ago we found that people under extreme stress will present with a heart attack. We go in, we do the heart catheterization, and we can't find any blockages. And the reason why the heart attack occurs is because of coronary spasm. It's like getting a cramp in the blood vessel. There's no blockages. It's just that the blood vessel narrows because it goes into spasm. And when the blood vessel is shut off like that, there's no blood flow to the heart. And when the heart doesn't get blood flow, then that muscle, that area gets injured. And so that's what broken heart syndrome is. It's under extreme stress. And I'll just give you kind of an example. I had a patient who, unfortunately, her son was killed in a shooting accident. And I tell you, just to see the pain, every time she came in the office, it was the most painful thing to watch. And her son had been gone for like 2 years, and she still just relived that. And just the intense emotions like that can cause spasming of that artery, and that's a well-documented thing we've seen in cardiology, first described by the Japanese. But that's what broken heart syndrome is.
Very interesting. Thank you.
Mm-hmm.
What are the warning signs of heart disease?
I would say that you have to really look at risk factors. I think you have to concentrate on risk factors. So warning signs to me, let's just describe what a warning is. I mean, what is a warning? You know, is it a stop sign? Is it a yellow caution? Is it a red light? What are the warning signs that we physicians get concerned about as it relates to heart disease? And those warning signs for us is if you start to have your blood sugar higher, your fasting blood sugar, or even a random blood sugar that's too high, or blood higher, or if your BMI is higher than it should be, your body mass index, or some people use as a surrogate to BMI your waistline. And how much exercise do you get? See, to me, all of those are warning signs that give me pause that I should be very concerned about these things, because if I have those things, then if they're there long enough, most people will develop heart disease. So you really have to think about them in terms of what causes heart disease in terms of warning signs, because if you have high blood pressure, that's a pretty big warning sign. Or if you've got diabetes, that's a warning sign. If you got high cholesterol, that's a warning sign. If you're overweight, that's a warning sign. All of those are warning signs.
Okay, thank you.
Mm-hmm.
Any more questions from the social media? Okay, here's another one. Doctor, I had a stroke 7 months ago. The only
Okay.
sign I saw was sleepless nights, and arm ache. How likely would the stroke happen again?
Well, if there wasn't permanent damage and they put you on the appropriate medication, you know, some strokes are caused just from what we call small vessel disease, or what they call lacunar infarcts. And those are blood vessels that are the tiny blood vessels at the very end of the arteries that supply blood to your brain. And so controlling the blood pressure helps to mitigate some of those symptoms. If the stroke is from a plaque or a blockage, cholesterol that breaks off and goes upstream into your brain, they can put you on blood thinner medications for that. So if they have to identify what your stroke was from, and B, you have to be on the appropriate therapy for that. that has a lot to do with whether there's a recurrence of those symptoms or not. So that's really totally based on the management. Thank God they found that you did, and I'm hoping that it puts you on the appropriate therapy for that.
Okay. Please explain the difference between a heart attack and cardiac arrest.
Okay, a lot of people get that one confused. A heart attack is when the blood flow to the heart is terminated, when it's shut off, when you're not getting any more blood supply to the heart. That causes an injury to the heart muscle and causes the cells in the heart to die. So we can measure that by measuring troponin levels and things like that. We can tell when you've had a heart attack. Like if you come in with chest pain, not all chest pain means you're having a heart attack. Chest pain is a warning sign that your heart is not getting enough blood supply. Unfortunately, that chest pain, if you don't get it taken care of, it usually only lasts for 3 hours. Because once you've terminated all the blood supply to the heart, after 3 hours, you don't have any more pain because the muscle is dead. So chest pain actually, or when you're having symptoms of a heart attack, means there's something there that you can actually, there's still some living muscle there that you might be able to save if you get there early enough so they can open up that vessel. But a heart attack means that you have injured the heart muscle because there's not enough blood supply. A cardiac arrest is different. A cardiac arrest means that you've had an overwhelming electrical disorder that causes the heart to stop beating. Just because you're having a heart attack doesn't mean the heart stops beating. But if you have a cardiac arrest, your heart literally stops beating. And that's when we have to do the, you've seen those pads, those pads that we put on people to shock them back. Or have you seen them do CPR where they have to compress on the chest? Well, if the heart stops beating and you have a cardiac arrest, we have to get you back into a normal rhythm. And oftentimes that requires getting shocked out of that. Cardiac arrest means stop, and a heart attack means that you're getting injury to the heart muscle because you're not getting enough blood supply. The two aren't the same. Now, you can have a heart attack that can result in a cardiac arrest, but the two are different.
Thank you for that explanation.
I hope that was clear. That's kind of a confusing thing. Yeah.
Okay. Can you speak on SVT?
Okay.
Can an SVT attack cause death?
Okay, now that's really getting technical. I didn't know we had such a sophisticated crowd here. I'm impressed. Really, really impressed. SVT is, excuse me, supraventricular tachycardia, SVT. And that's what I basically did for 25 years. I managed those arrhythmias. And generally, SVT is, when they say supraventricular, that means it's above the ventricles. It's in the atria. So you've got 4 chambers of the heart. You've got 2 atria and 2 ventricles. Upper chamber, lower chamber. SVT in simple language is the upper chambers of the heart. VT is the lower chamber of the heart, ventricular tachycardia. So SVT is a rapid heart rate, generally greater than 120. Most SVTs are around 160 beats a minute, and it's because you were born with an extra circuit in your heart. There are multiple different kinds of SVTs, and what we used to do is, as electrophysiologists, we had computers that I could map out in your heart where the arrhythmia was occurring from, and we could fix it by using radio frequency ablation, where we actually use radio waves to eliminate the extra circuit in your heart and prevent you from having it. There are some SVTs, like with Wolff-Parkinson-White syndrome, which is people that are born with an extra circuit, that can lead to really, really fast heart rates. And there is about I'd say the 2, 3, 4% chance of dying from something like that if it's Wolff Parkinson White. But they're not, SVT is just a broad category. There are multiple different mechanisms for causing the fast heart rate, but they're all lumped into the category of SVT, supraventricular tachycardia. And specifically, Wolff Parkinson White can lead to death. So if you're having symptoms of a really, really fast heart rate, you need to see a cardiologist, and then they'll get you to somebody like myself, an electrophysiologist, that can walk you through how to manage that and how to treat it appropriately. You've got medications. They don't do surgery anymore because our non-invasive techniques have gotten so much better, but we can actually fix those pretty easily.
Thank you.
So far, that's all the questions on heart troubles.
Oh, those are great questions.
Heart troubles
I have
on Sunday for my pastor.
Okay, I have two more real quick. These were already that we had. How serious is a heart murmur?
A heart murmur is the blood flow. When we use our stethoscopes, or if you get an ultrasound of your heart, we're actually looking at the blood flow across the valves in the heart. And when there's an abnormal sound because the flow is abnormal, we can hear with our stethoscopes, or we can find with an echo, we can determine what the abnormality is. Not all heart murmurs are dangerous. Some heart murmurs are actually pretty benign. They don't really, lead to anything significant. There are other heart murmurs, abnormal blood flow across the valves, that are very serious. And usually we can determine on physical examination or with an echocardiogram just how serious that heart murmur. So to answer your question, a heart murmur is an abnormal flow across the valves in the heart. And it just depends on which valve determines what the murmur is. But that's all a heart murmur is.
Miss Ella, you want me to do our final question?
Well, is that our final? Do we have any more online questions? Is that it? Okay. So Dr. Noble, just to sum up, what is your advice to us this evening to maintain a healthy heart?
I would, first off, I want to thank everybody for allowing me to, just to speak to everyone today about heart disease. Again, especially in, communities of color, but just in the United States in general, it's such a major problem, and we just can't talk enough about it. So the real tenets of a healthy heart really haven't changed. Since I went to start medical school in 1981, and I started my residency in 85, and my cardiology in 1989 to 91. And the advice has not changed over the years. And that is, you really need to eat a balanced diet. Now, I'm not a nutritionist. I won't begin to talk about keto diets, DASH diets. But it's so important to eat a healthy balance of vegetables and fruits, whole grain, and lean meats. And so the diet is just such a critical part of that. The CDC has recommendations for exercise. Generally, they say that you should do at least 20 to 30 minutes of some kind of exercise 5 days a week. That includes your cardio, which gets your heart rate up and you're breathing a little heavy, as well as resistive training by doing some kind of weightlifting. And they're pretty clear about that. At least 5 days a week, you should be doing that. After age 50, most of us lose about 10% of our muscle mass. So if you're not doing resistive training, then you're losing that muscle, and that muscle is the best way to burn those calories and to keep you from having diabetes. So it's really important to exercise. But the diet is probably the most important thing. Your exercise, and then lastly, just those things I talked about. in terms of managing your blood pressure. If you got high blood pressure, take your medications. And personally, I think everyone, if you've got hypertension or high blood pressure, you ought to have one of those cups you can buy from CVS and check it yourself and keep a chart of it. If you're diabetic, you've got to manage that diabetes properly by taking the medication, checking it yourself, making sure you're following with your docs, and those kind of things. If you have high cholesterol, I know people don't like taking the statins, but if you have risk factors like a diabetic and you have high cholesterol, that increases your risk score tremendously. And so you've got to take the medication. So I think in summary, eating a healthy diet, getting plenty of exercise, following up with your physician, following his advice, and take ownership of your health. Ask questions when you're in the doctor's office. Look up things. Just don't take my word for it. Look it up. And if you don't understand it, find somebody who can explain it to you. Because as soon as you're able to understand it and take ownership of it, trust me, those are the patients that do the best.
Thank you so much, Dr. Noble, for joining us this evening. And I hope those of you who are watching this evening have heard something that will make you take a look at yourself and say, what can I do to maintain a healthy heart? Thank you so much.
God bless everybody.
Thank you.
Thank you.
Okay.